Hello, everyone. My name is Catherine Leeson, and I'm a junior doctor working at Hollywood Private Hospital in Perth, Western Australia. Today, I'll be presenting an audit of airway difficulty documentation. So, why are we doing this audit? Well, accurately describing, documenting, and communicating any adverse event or difficulty related to airway management is essential for ensuring patient safety and effective clinical care. The Difficult Airway Society from the UK recommend thorough documentation of airway difficulty. Similarly, the American Society of Anesthesiologists practice guidelines for management of the difficult airway highly advise documentation of the presence and nature of any airway difficulty. This should include description of the specific difficulties encountered, distinguishing between difficulties during bag mask ventilation, supraglottic airway insertion, and endotracheal tube intubation. Based on these guidelines, I carried out an audit to determine if documentation of airway difficulty is meeting the recommended standards. A prospective audit was carried out on all patients who entered the recovery unit on a midweek day in December 24. These cases were all elective surgeries from a wide range of specialities. The anaesthetic charts were analysed to assess if these boxes were completed. These boxes serve to highlight the difficulty faced with bag mask ventilation and difficulty of LMA or intubation. 67 patients were included. 10 patients were administered intravenous sedation and maintained their own airway, so were excluded from further analysis. Among the remaining 57 patients, 41 underwent supraglottic airway insertion with a laryngeal mask airway, and 16 underwent intubation with an endotracheal tube. Difficulty of bag mask ventilation was documented in 27% of LMA patients and 69% of ETT patients. Contrastingly, difficulty of LMA or ETT was documented 76% in the LMA group and 81% of the ETT group. These results highlight that documentation of LMA insertion or endotracheal intubation was more consistently recorded than bag mask ventilation difficulty. Current guidelines from the Difficult Airway Society and American Society of Anesthesiologists emphasize the importance of documenting all forms of difficulty, including bag mask ventilation and intubation and LMA difficulty. Although these resources do not state a specific target for documentation of these variables, we should aim to clearly outline the difficulty of airway management in all operative cases. We need to increase awareness and compliance with documentation standards to improve communication and ongoing patient care. Thank you.